Good afternoon, everyone. Hope everyone is having a good day, staying dry if you are out, and staying healthy and doing well. It's been a few days since we last caught up, so figured it would be a good chance to update everyone on what's happening in the county. Unfortunately, or fortunately, depending on your perspective, you are stuck with me alone today. No special guests, so I think this will be a relatively shorter update. And but we do have some substantive things to cover, so I'll jump right in. I'll try to answer a few questions, but we're going to kind of shift more to a mode of these being updates and rather than the talk show, as I joke, format, which I think I want to be respectful of everybody's time and know that there's a lot going on. So as usual, we'll start with the data and what's happening on the ground in Ulster County. This is our updated current numbers and projected numbers. We unfortunately crossed the threshold of now over 1,000 positive cases in Ulster County. We're at 1,018 positive cases. That's out of 4,797 tested. So we're at about a 21% rate of positive tests compared to those tested. This is a number that over time we want to see get lower and lower and lower down into at least the single digits before we would even begin to feel comfortable that we're doing enough testing. I'll talk more about our testing capacity in a little bit, but the fact that over 1 in 5 of our tests is still coming back positive means we have more work to do in terms of getting our testing up there more broadly. Unfortunately, we now have 17 fatalities, 17 Ulster County residents, their family, their friends, their loved ones that have been impacted by COVID. And there are many others in the hospital now, several in critical condition. And so we are thinking of them. We're sending all positive thoughts we can and love to them and hope that they're hanging in there as well. The good news, we are beginning to now track on our website individuals recovered. This isn't a perfect number. These are people that have either been released from the hospital or that have passed the threshold of time in quarantine and are no longer showing symptoms for an adequate amount of time. So there's right now 149 recovered. I think in reality that number is higher, but we're being very cautious in how we're tracking that number. If you look to the right half of the graph at the projections, this is where I think it's important that we spend a good amount of our time and our thought. So this is our attempt to look 10 days out and assess what the best case, most likely case, and worst case will be based on the numbers that we are seeing. Before we talk about the forward projections, I do think it's important to go back and look backwards and test our projections against reality. So this morning I went back and looked 10 days ago what we had projected. We are right between if you look at the projection from 10 days ago, right now we're between our worst case, or excuse me, I'm sorry, between our best case and our middle case. So that's where we've been, kind of between those two lower projection lines pretty consistently, which is very good news. That means all the things that we're doing in terms of pause and staying home is having an impact. And if you look forward, what that means is if we continue to be in that space, in 10 days from now, we are very likely to be somewhere around 1,400, 1,500 positives, which would be very good news, at least in a relative perspective. So you can see there the projections going forward. In the best case, 1,450 in 10 days, 2,300 in the most likely, and over 3,600 in the worst case. Fortunately, again, we have been able to stay closer to the best case in all these projections if you look back historically. So that is good news. The other thing that I want to talk about while we're on this topic is testing. You've heard the governor talk a lot about this and public health experts talk about the importance of testing. Over the weekend, there was some really good analysis by the Albany Times-Union of statewide what's been happening with testing. And I am really proud that Ulster County is one of the leading counties in the state in terms of the percentage of our population that we have been able to get tested. And that's a credit to our whole team that really worked to get our testing sites up early and to continue to push them through. It's a credit to our healthcare partners, particularly New Vance and Ellenville Regional Hospital. But we've only tested, of all the residents in the county, under 3% of our total population. And we know from all the scientific expertise that if we're going to make our way out of this, we need to drastically increase the number of folks that we're testing. So that's something on our mind that we're continuing to work on. We're trying to figure out how to make it easier for people to be tested, whether that's more sites, whether that's making it easier to get an order, even if you don't have a doctor or a primary care physician. So hopefully by Thursday we'll have more news there, and we do have one update there that I'll talk about a little bit in terms of additional testing capacity, which is good news. So that's the numbers in terms of cases. If we take a look, as we always do, at what our capacity is, our hospital and medical treatment capacity, obviously we want the capacity of our hospitals to be able to meet or ideally exceed the need in terms of cases. The good news at a top line is we pretty much have what we need right now. You can see we have 37 COVID-19 patients between our two hospitals physically in Ulster County, 6 of them in ICU beds and on ventilators, and essentially we have sufficient need for the near term. And I want to thank our two hospital systems here in the county, Health Alliance and Ellenville Regional, your leadership team, all of the doctors, nurses, staff, everyone that has stepped up to make sure we have this capacity. We want to thank you for that. I also want to thank many of our residents in the county go to other to other counties and other hospitals for treatment. We have county residents in across the river in New Vance, south of us in Orange Regional, at St. Luke's, and many other hospital systems. So we know we're a region, and the county lines are somewhat arbitrary, and I want to thank those other hospitals and healthcare systems that have stepped up as well. If needed, we do have our community care center ready to go at the field house at Kingston High School, but right now it's good news that we do not need to use that. But again, we are ready if needed to stand that up if the conditions change. That's the data, and here's a little bit of editorial commentary. We're now almost 7 weeks. I've lost track of time a little bit into this situation, and I understand every day gets harder and harder to stay home, to have your whole life interrupted, to deal with not having an income or a job or food or many other critical needs, and I understand that. But to me, all the data and all the expertise makes it clear that we have to continue to hang in there a little bit longer in this situation, and that doing so will mean the difference between people's lives ultimately. So I want to remind everyone, especially as the weather gets nicer, especially as people are getting a little stir crazy at home, which I understand, which we all understand, that New York State pause, the statewide guidance from Governor Cuomo, remains in effect. That basically means, as we've all heard and as we know, stay home, slow the spread, and ultimately save lives. I think that it's just critical that we understand we're right at this moment where what we do in the next few weeks will have a dramatic impact on that curve. And I know there are more and more calls from folks to open things up or loosen restrictions, and that's understandable. But to me, now is not the time to let our guard down. In fact, it's the time to just hang in there and hang tough, and just know that's how I'm thinking about this. And I'm asking your help to just do that a little bit longer. I wish I could tell you exactly the day when we'll be able to change that, but know that I think the light at the end of the tunnel is beginning to be visible, and that's encouraging, but we've got a ways to go till we're there. In the meantime, we continue to get messages and concerns from folks about gatherings or folks not following the pause policies. If you have that feedback, we do have the Pause Enforcement Task Force, which is a statewide entity. You can go on our Ulster County COVID-19 website. That's ulstercounty.ny.gov/coronavirus. And on there in the form section, you can fill that out, or there's an 800 number. Actually, it's an 833 number, 1-833-789-0470. As those calls come in, we vet them, and between town and municipal leaders and law enforcement, if needed, we'll follow through on those. And I do encourage you to take advantage of that if needed. Two other things that I wanted to talk about today. As we learn more and more about COVID-19, and we look at the data, and we have a little bit of time to process what's been happening and how this as a health epidemic has intersected with our society, with our economy, and with our culture, it's clear that the intersection between those two has caused some maybe predictable but possibly unanticipated consequences. You could debate about that. What's clear to me is long before COVID, in Ulster County, in New York, in the country, and around the world, we've had systemic inequality in many of our systems. Our healthcare system, we know, many people not able to have the access to that they should at a cost that they can afford. Our economy, we know many, already 4 in 10 homes living paycheck to paycheck, people struggling with economic insecurity and homelessness and other need. And then we know racial inequality and other forms of similar inequality that have compounded those other problems. It's clear to me, and we're looking at the data in Ulster County right now, and we'll have more of that to share soon, but in New York State and across the country, there are clearly disproportionate impacts of COVID-19 on communities of color. And I think it's important that we recognize that we as a first step, and that we do everything we can to address it here in Ulster County. And I'm committed to doing that. Our team is committed to doing that. Some of the first steps that we're taking here, and these are just first steps. One, I've asked our health commissioner to prepare some analysis of, to the degree we have this data, and it's imperfect, what the ramifications and what the numbers look like in Ulster County. But we know, and I think can anticipate pretty confidently, that there will be those systemic disproportionate impacts. So I've already directed our Human Rights Commissioner, who is a phenomenal leader in our community, to begin developing a plan in consultation with other leaders in our county government and local governments and other community groups to address this, to better communicate with communities that are often disconnected, as well as to think about other steps we can take to address this. One of the biggest challenges that we've heard is, to my point on testing, we've lacked good, reliable access to testing sites. And we've had 2 testing sites in Ulster County, one in the town of Ulster at Tech City and one at Ellenville Regional Hospital. Those still remain in place, but we know one of the greatest places of need and inequality and poverty in Ulster County is in Midtown Kingston. And so I really am optimistic and pleased that, thanks to our partners at Health Alliance, we are going to, by next week, have a 3rd testing site up and running in Midtown Kingston, which will serve anybody, of course. You can walk up, you can drive up. You do not need a doctor. You can call ahead to them, and they can walk you through the screening process and make sure you get taken care of. And you can always call our Ulster County COVID-19 hotline as well. But the idea here is we know we need more testing, particularly for communities that have struggled to access testing and other healthcare resources. And this is one important step to addressing that head on here in Ulster County. And I really want to thank particularly Dr. Doyle, who's been on here with me multiple times now. I called him about this at the end, I think it was maybe Friday afternoon, and said, hey, can you help us here? And he immediately said, yes, let me work on it with my team over the weekend. We spoke this morning. We'll be putting out more details, but we anticipate by early next week that the site will be up, that it will be, again, accessible to everyone in Midtown Kingston at least 5 days a week. And so I think that's a good news story for the whole community, and I really appreciate Dr. Doyle and your whole team being willing to do that for us. The other area that I think is important that we address, and we have been addressing, but I want to talk about, again, looking at the data, we know that seniors in particular are not only vulnerable from a medical perspective to COVID-19, but by virtue of the fact that we have 13 senior facilities, assisted living, nursing homes, and other senior facilities in Ulster County that often have congregate settings and a higher density, that compounds the medical risks due to that density. And so, like we've heard statewide and to a certain degree nationally, those senior facilities are a top priority for us. And ultimately, protecting the health of our seniors is something, well, frankly, it's very personal to me as well. My grandmother, who turned 89 about a month ago, we couldn't be with her on her birthday because she's in an assisted living facility here in Kingston. Like so many others out there, we haven't been able to see her in person now for going on 2 months, and it's very difficult for her and everybody. And I know that there are hundreds, if not thousands, of families in that situation that are even more nervous as we see the numbers and the stories and the data coming out about senior facilities. So we in Ulster County are leaning into that. We have established a rapid response team that's composed of public health experts that have and will go into all of our senior facilities. They will work with them to make sure all the proper protocols are in place from a public health perspective, to make sure they have the personal protective equipment, PPE, that they need. And if the facilities request it and we have enough tests, which we're working on, we will test every resident in the facilities. We have now done that in one of our 13 facilities. And what I think is important, we're not going to share all the numbers, but of almost 100 folks tested, over 20% of them came back positive and asymptomatic. Positive and asymptomatic. I think as in general, as we ramp up antibody testing in the state and the country, we're going to learn more about how many people might be carrying COVID but not showing symptoms. But in this small sample set, that was a significant number in a very vulnerable population of asymptomatic seniors who we now have a much better picture of how to isolate them and keep them healthy, as well as keep the other members of that facility healthy. So we'll be replicating that in our other 12 senior facilities. I appreciate the partnership of those senior facilities, and we're working with each of them, our emergency response and public health team, Dr. Smith and Steve Peterson. So we'll keep you updated on this, and know that that is very important to us, and we're going to keep working on that. Shifting gears a little bit, I still mostly spend most of my time, and most of our team spends our time, in what I would call the immediate phase one, if you will, response. The public health, how do we track the virus? How do we trace and isolate those that are positive? How do we prepare hospital capacity to deal with the medical need? How do we stand up more testing sites? All of those public health kind of phase one responses. And we will continue to do that, and hopefully soon we'll be able to ramp that down. But in the meantime, we're going to continue to ramp that up, frankly. But in parallel, I have asked my team, and I've been spending more of my time thinking about really phase two, which is a broader recovery. Not specifically economic, although we've talked about that and we're going to continue to work on that, but really a comprehensive way to think about the fact that this was a devastating shock to our whole society, and we're just beginning to feel the ripple effects. Every day, day over day, the need for critical services, human services and social services, is growing, and we're getting more and more calls for people needing mental health support, addiction recovery support, housing need, food need, the list of critical things that many of us took for granted before this, and that some were already struggling with. It's going to get compounded, and frankly, each day that the economy is remains the way it is, as we must do, this just gets worse and worse for so many folks. So in the coming days and weeks, we will roll out a comprehensive plan for an Ulster County Recovery Task Force. And really this will be about making sure that just the way that we did our best to be ready for the medical and public health wave and epidemic, that we're ready for this next phase 2 wave, which is going to be a huge amount, and almost probably unprecedented in the last many decades amount of need for all of these critical services. And county government really is at the forefront of delivering so many of these social services and human services. And we know we're going to be strained, and we're doing everything we can to prepare for that and to improve those processes. So more to come on that, but I just wanted you to know that we're thinking about that, not only as a government, but with all of our partners, all the not-for-profits, community groups, religious groups. We're all going to need to be coordinated and working together to meet this need, and we'll be announcing the plan for that either later this week or next week. Finally, I always like to end on more optimistic and positive notes, so we'll talk a little bit about Project Resilience, and we'll talk a little bit about our Community Champions program. I'm going to take a sip of water, though, because I've been talking for a while. I continue to just be so impressed and proud and frankly humbled by what we're doing with Project Resilience. We now have over 3,000 households in the county that have requested assistance. We've delivered over 60,000 meals relying on and thankful for 16 local teams that are established to distribute these meals. One of my colleagues here in county government did some deliveries over the weekend. He shall remain nameless, but he told me Monday morning it was one of the most well-oiled, finely tuned operations machines he had seen. Showed up, picked up the meals within an hour, delivered dozens door to door, and that does not happen by accident. That's the result of a lot of hard work, of tremendous generosity of volunteers, and the generosity of folks who have contributed financially to that. Over the weekend, we sent out a request for additional funding to Project Resilience to keep us going. I should have the exact number. I don't have the exact number. It was tens of thousands of dollars in small and a few large contributions. I just happened to look on Sunday night. An anonymous donor gave $10,000. We had many people give $3, $4, $5, $20. Every dollar is allowing us to deliver meals to those in need, and also to provide daycare and childcare services to first responders and to cover or help cover those costs. So I just want to thank everybody who's working on that. Thank all of our partners on the ground in each town leaders, food banks, and others that are all part of this network. It's really a network of communities stepping up to meet this need, particularly the food need that we're experiencing. I've done this before, but it deserves to be done every time. I want to thank all of our residents who are on the front lines, from healthcare workers to grocery store staff, public transit, teachers and daycare workers, pharmacy workers, or mail carriers, of course, journalists, Of course, I want to thank Radio Kingston, who continues to help us get this message out. We appreciate it. I always forget to thank, and I want to thank our ASL interpreters, Diane and Roxanne, for what you're doing and have been doing. I want to thank Manuel as well from Radio Kingston, who's live or near live translating this to Spanish. We appreciate that. We're doing everything we can as a community to not only take care of each other, but to communicate with each other in ways that we've never quite had to do. So I think we're doing, not perfect, but we're doing pretty well, and I'm really proud of that as well. So thank you, everybody, for what you're doing. And I want to end by specifically recognizing we stood up a program last week called Ulster County Community Champions. We set up a form on our website, which is still there, where you can nominate someone who's probably too humble to ask for or the recognition, but who clearly deserves it. And our community champion that I want to highlight today is Katie Altu from Lake Katrine. Like many folks around the county, she is a family child care provider, and she runs the Mountain Rise Daycare. I'll just say a brief detour. I know our daycare in New Paltz, in a similar way, have heroically stepped up, kept the doors open, and kept everybody safe, like I'm sure Katie and her colleagues are doing. Not only has she done that, but she, on her own, in response to COVID-19, started a program to provide emergency child care for the children of essential workers, so that those essential workers, healthcare workers, can keep us safe and keep us taken care of, and know that their children are safe and healthy and being cared for. And I can tell you, that is literally the most important thing to parents. They're already stressed at work, to know that their children are being taken care of. And not only taken care of, Katie has gone above and beyond. She's been recording these videos of herself reading children's books in both English and Spanish, explaining different learning activities, and she's sharing all that publicly, so that parents like me and Rebecca, who need ideas for how to keep a 9-month-old busy and help them develop along the way, are able to benefit from them. So just another example of not only keeping her business open to take care of children, but also going above and beyond and contributing to the community to help others do the same. So Katie, on behalf of all the residents, the 180,000 residents of the county and beyond, we want to thank you for what you're doing and the example that you're setting. I know there are many others doing this type of work as well, as I said, but I think it was one of your colleagues, wrote in and nominated you, so I won't name them, but thank you for what you're doing. I think that's probably enough of you all having to listen to me ramble on. I know we're getting some questions and comments. I will, in the interest of time, we'll go through those. If there are big ones that we're hearing over and over, I tried to address a lot of them today in my remarks, but if there are ones that we miss, we'll make sure we'll hit them on Thursday. Our next briefing, our next update on Facebook will be Thursday at 2 p.m. We should have significant new updates then as well. I know it can feel a little bit like Groundhog Day for all of us. I've definitely lost track of the day of the week and sometimes time of day and everything in between. But I just ask everyone, as I said, and I just think bears repeating, now is just this critical time where not just your own health and your family's health, but the health of so many others, the decisions that you make will impact them. And so ask everyone to continue to stay safe, to stay home when possible, when not, to follow all those protocols, and ultimately to hang in there, stay resilient, lean into your community, lean into the positivity, and we look forward to seeing you in 2 days. Stay healthy and talk to you soon.